All right, so I'm going to be talking about the etiology of tetralogy of Fallot, or TOF. TOF is actually the most common cyanotic heart defect in children beyond infancy, and it makes up about 5 to 10% of all congenital heart defects. It develops very early in pregnancy during the first few weeks when the baby is still forming. Most of the time, in about 75 to 80% of cases, TOF happens by itself, meaning it's not really connected to any larger syndrome. Of that, 7% of those cases are linked to genetic mutations that affect heart development. Some of those main ones listed here are Notch1, FLT4, and TBX1. TBX1 is important because it's also linked to a condition called the 22q11.2 deletion syndrome, which is something that I will address more in a bit. Now, the other 20 to 25% of patients with TOF do have a genetic syndrome that goes along with it. So the two most common ones are going to be Down syndrome and DiGeorge syndrome, which is caused by that 22q11.2 microdeletion I just mentioned, which I thought was really interesting. These syndromes can come with other health issues too, like facial differences, immune issues, and or learning difficulties. Even though we know that some of the genes and the conditions that are linked to TOF, the exact cause is still not fully known yet. It's likely a mix of genetic and environmental factors during pregnancy. And to kind of expand on those environmental risk factors that have been linked to TOF, so that's going to include maternal diabetes, mellitus, retinoic acid exposure, which can come from certain acne medications, and as well as maternal phenylketonuria, which is a metabolic condition. There's also a small family connection. So if someone in the family already has a congenital heart defect, there's about a 3% chance that another baby might be born with a heart defect too, although it isn't necessarily TOF. And all of these changes, whether from genetics or from the environmental exposure, they impact how the heart forms and as well as how the blood flows throughout. And that's why it leads to the 4 key defects seen in TOF. So that's going to be further discussed in the pathophysiology portion. But just as an introduction, the 4 defects seen are going to be ventricular septal defect, pulmonary stenosis, and overriding aorta, and right ventricular hypertrophy.